Welcome to Under the Tree, the podcast where we bring education, resources, and support directly to caregivers and families. I'm your host, Robert Valasak. We know that caregivers are often balancing work, family responsibilities, and the care of a loved one. Because attending workshops and educational events isn't always possible, our goal is to bring these important conversations directly to you so you can access information when it works best for your schedule. Today, we are joined by Kevin Gebhard, a licensed health insurance agent specializing in Medicare Advantage, Medicare Supplement, and Affordable Care Act health plans. For many families, Medicare can feel overwhelming. Understanding enrollment deadlines, coverage options, and healthcare costs can be confusing, especially when you're trying to help a parent or a loved one make important decisions. Today, Kevin will help us understand the basics of Medicare and what every caregiver should know. Kevin, welcome to Under the Tree.
Yeah, thank you, Robert. Glad to be here.
Do you mind telling us a little bit about yourself and kind of what you do?
Yeah, would be glad to do that. So I'll start off a little bit of background from before what I was doing now. So first off, family-wise, I'm married for 26 years now, and we have 5 children.
Oh, wow.
So that's so two things that make us unique. So one is we have a big family, and my oldest daughter just was married. I walked her down the aisle last year, and she's actually expecting next month.
Oh,
so I'm going to be a grandpa.
Congratulations.
So I look too young, right? So and so then we still have 2 at home. The other 3 are in college or married. So a little bit of background. I got my master's in economics and did financial advising for a while, but mostly was doing teaching. So I taught economics at Oakland Community College. I've also tutored at LCC here in town before too. And then, but the other unique thing, I guess, about us is that we were missionaries overseas. So we lived in China for 3 years and Taiwan for 2.
Oh,
so
wow.
yeah, so a total of 5 years that we were in Asia. All the kids, came with us and everything, and it was experienced a lot of really interesting things, some hard things too, but. Sure. Overall, really thankful that we had the opportunity to go there. What brought us back actually was my wife and daughter's health. So my wife is better now. My 3rd daughter, Shelby, is still having some issues. So we decided it'd be best to stay here in the States. So was still with Send International, doing some things locally here with refugees and international students at MSU, but it's kind of becoming more part-time. And then those 5 kids that were in diapers now are in college and getting married. Yeah. And I used to think diapers was expensive, and I'm like, oh, that's not too bad compared to college and weddings. So at any rate, one of the churches that was sponsoring us had a couple there, John and Terry Skidmore, and Terry was a health insurance agent for 17 years. I was looking to retire and wanted to find someone that she could mentor and to kind of take over the book of business for her. So that's the roundabout way that I got into this. And I've been really enjoying it so far, even more than I thought, actually. It does, so sometimes I'll do some seminars for teaching, but again, I love tutoring, and so really the process of signing someone up for Medicare is more like tutoring than it is sales, because they make Medicare so confusing.
Oh, yes.
That it is more of an educational experience than it is just going over whatever salespeople do, I guess, a used car kind of thing.
Yeah, exactly. Yeah, so wonderful. Thank you. What is Medicare and who exactly qualifies for it?
Sure. So Medicare is government subsidized insurance, I guess. So it's not that, again, when we were in Taiwan, actually, they had social medicine, right, where the government pays for everything. And this is more like the government is going to pay for 80% of your medical for the most part. But that, and then my job usually with other people is what do we do with that other 20%? And so as far as who's eligible for Medicare, once you turn 65, is the main the lion's share of people who are on Medicare are seniors over 65. Almost everyone will enroll in Part A right away. Okay. Some people, if they're still working, will hold off on Part B. So Part A, if you've been a taxpaying American for 10 years, there's no charge for that. Part B, though, for the majority of people is $203 a month. And so if people can get that through their employer, they may hold off on Part B. So The other group of people who are on Social Security, who are on Medicare, are those who are disabled under 65. There's a couple other like end-stage renal disease. There's a few other ones, but the main one is those who are disabled, and then those who have retired over 65.
That kind of leads into our next question. What are the different parts of Medicare?
Yeah,
we got A, B, C, and D.
Correct. So I started saying a little bit. So the Part A, which I mentioned, is going to be usually no charge for that. I think of A as standing for admitted.
Okay.
So if you're admitted overnight in the hospital, that's going to be Medicare Part A.
Okay.
And also maybe what happens after. So if after means skilled nursing facility, or if afterwards means hospice, that would be Part A. Medicare Part B, I like to think of B as being beyond. So everything beyond overnight at the hospital is Medicare Part B, including outpatient surgery. So again, if it's not overnight, the drugs at the hospital, the doctors there, the doctors anywhere is all Medicare Part B.
Okay.
Yep. So I'm going to skip C for now. D is easier to remember. So Part D is drugs.
Okay.
And the drug coverage specifically at the pharmacy, again, not the ones at the hospital through the IV.
Okay.
And then all the other letters that you hear, C, G, N, is kind of dealing with that other 20% that we talked about. So the Medicare Part C is basically a Medicare Advantage plan.
Okay.
That's one way to cover the 20% that's going to include some copays. If someone wants a supplement, then there's going to be, they're going to pay very little at all, the doctor, and so they're going to pay monthly. So in other words, Medicare Advantage, you're going to usually pay very little, if any at all, monthly, and then you'll have copays at the doctor, and supplement is the other way around, where someone is going to pay monthly, but then usually not pay at the doctor.
Well, thank you for explaining that. I know that can be confusing.
Yeah. So.
Why do so many people find Medicare so confusing?
Yeah, you're in good company. You don't have to. I think people. I feel bad because I've had some people as I've done seminars. They say like, "Oh, I feel like I'm an idiot because I don't understand this." But no one needs to feel that way. I actually signed up a doctor for the first time last year, and he was confused with how it works. So jokingly, I like to think that the founders of Medicare, what they decided to do was, they tried to think of, okay, how can we make this simple and easy and so anyone can understand it? And then they decided to do the opposite. This is kind of, what I like to joke about. But in honesty, I think what it was is that when they created Medicare, it wasn't. They only created parts at a time. Okay. So I think that's part of what makes it so confusing is that they had to do, Part A and then later there's B and so things keep getting added to it and things changing. And so I think that's more why it makes it confusing is because it didn't come as a finished product at all.
You were just adding on as we come along.
And they still are making changes every year. And again, some of it is the U.S. health system too, and just there's a lot more, unfortunately, that can go wrong with your body than your car, for instance, right? Yeah. Mm-hmm. And so there's just a lot to it. Is I think a big reason why. So.
Okay. What are some of the biggest mistakes you see when people make when they're enrolling?
Yeah, good question. So, if by biggest mistake you mean the worst as far as the biggest consequence, it would mostly be those who just don't enroll at all. I would say that. Now that's pretty rare. I think most seniors have heard from friends and family that you need to enroll, but there are some people out there who are confused about it. They're only enrolled in A and B. In which case, you do have to pay 20% of everything. Okay. So, in a 20% bill of the restaurant for a tip is one thing. 20% at the hospital is quite another. Medical is the number one reason for bankruptcy in America, even for young people, let alone for seniors. And I believe that the rate of bankruptcy with seniors has tripled over the last generation.
Oh my gosh!
And again, medical is a big reason for that. So the biggest one is just for some people if they don't enroll at all. Beyond that, there are some mistakes, although. For the most part, as long as you're enrolled in something, I think you're going to limit the mistakes on that. So, so if by biggest mistake, though, you mean the most common, I think actually would be over-insuring. So I mentioned, there's the supplement where you hardly pay anything at all, the doctors, and so many people love that, and so they'll tell their friends and family about that, and so the coverage is very good, but it does start to get expensive. For someone who's 65, it's about $200 a month, and that's on top of the $200 a month already for Part B,
Okay.
which isn't terrible. But by the time you're in your 70s, that's $300 a month. In your 80s, it's maybe
Sure, you're
$400
on
a
a
month.
fixed income, maybe.
Yeah, and it's really been going up a lot recently. So medical inflation is already 5%, but Medicare supplement has been between 10 and 15%
Oh,
increase.
wow.
This year is actually 20%. So
Wow.
at that rate, you're doubling every for like 3.5 years. So it's just something that is worth looking at because the coverage is good, but it can get very expensive, especially for people on fixed income.
Okay.
So, one other thing I should say, mistake-wise, the bigger mistake, I guess, than not enrolling in Medicare at all is sometimes people will just forget to enroll in the drug portion. And so the problem with that is not only potentially having to pay drug costs, but what happens is a few years later, if you sign up, then you're penalized for all the years that you didn't take it.
Wow.
So if you don't enroll in Part B, that penalty is really stiff. It's 10%. Per year. So again, like I said, it's $203 for Medicare Part B. So if someone, 10% of that would be $20. And so if someone didn't enroll in Medicare Part B for 3 years, that'd be $60 a month penalty, and that penalty is for the rest of your life.
Wow.
Yeah. So
Wow.
and then so for the Part D drug plan, that's more like $4.50 per year.
Okay.
But again, and there's options that you can enroll for $0 premium. So you definitely want to enroll in something, if nothing else, just to avoid those
Sure, the
future
penalties, right?
Correct.
Okay.
Yeah.
Wow, that's great information. When should someone begin planning for the Medicare enrollment?
So you can pre-enroll in Medicare 3 months before you turn 65, or for people who are already on A and maybe they're 68 and they want to retire, again, they can pre-enroll 3 months before that.
Okay.
You can also enroll the month that you do retire or turn 65, and they also give you 3 months afterwards. So, but there's no reason not to sign up those 3 months before. And so I think, if you're really a go-getter, I guess you could do all your research before, but I think, probably 4 months before just to start looking around. And then again, that third month before is when you can start to pre-enroll. So that would be a good time. And, look into some different companies. For the most part, in order to be a Medicare plan, you have to meet certain requirements. And so that limits, the mistakes that you can make there as well.
Okay.
But there are some companies that are better than others. The national companies right now are for profit, which is okay, but they do have shareholders they're trying to please.
Yeah.
And so for Medicare Advantage plans, with the costs rising so much, there are a lot of pressures. And so a lot of the national companies, which are like the ones that you see on TV a lot, I don't know if I want to, badmouth any specific ones, but they tend to do a lot of prior authorizations. And so maybe I should have mentioned that as another mistake that sometimes people will make, is that they have these national companies, and then, so prior authorization is where, you and your doctor say that you need the surgery, and the insurance company says, well, do you really need it? And now 90% of the time that does get approved, but 8 or 9% of the time it doesn't. And even when it is approved, you have to appeal, or there's delays, and so it can be a pain. And so for one, there are some people, to the extreme. I have heard of I do have a client I just signed up where one of his family members was waiting on a prior authorization, and he either was rejected or the delay was so long, and the person's health
Oh my God.
became terminal. So that's rare. But again, I don't want people to experience that. The doctors don't want that either. And so some of the hospital systems have begun putting these national companies out of network. That would only affect Medicare Advantage, not supplement.
Okay.
But so for instance, like my Michigan hospitals up north, and Lansing actually hasn't been a problem, but Trinity Health in Detroit, Corewell Health in Grand Rapids, and actually, so regionally there'd be like Cleveland Clinic and Mayo Clinic. Those ones have all put those national carriers out of network. So, so just that would be something worth researching a little bit at least, and but I don't think you necessarily need 6 months to do that. So just a couple months should be fine.
Okay. I know you kind of touched on this a little bit, but what are penalties that can occur if someone misses the enrollment deadlines?
Yeah, I guess I already answered that one a little bit. One thing I should say, I guess, is how do you avoid those penalties? So, of course, the easiest one is just to enroll in it when you can. But I think when people are most concerned is, well, if they hear about these penalties of 20% for the Part B and that $4.50 or so per year for Part D. And so if someone is 65 and still working, I think they are nervous about getting that penalty. The good news is that if you are enrolled in what's considered qualified coverage, then you're exempt from those penalties.
Oh,
so,
okay.
If someone, again, almost all employer plans would count for that. Things that would not count would be like travel insurance or short-term insurance, something like that. But as long as you're in a full legitimate, usually employer plan. Then when you retire, you'll talk to the HR department. They have a L564 form or something like that that the HR will help you to fill out to say, hey, this person had coverage, and so they're exempt from those penalties.
Very good. I'm sure you get this question quite a bit. How does Medicare differ from Medicaid?
Great question. So yeah, the names are so close, right? And they're both government programs. So people misuse those all the time. I even sometimes
it's confusing. It is.
So, but basically, Medicare is for the elderly and disabled, and Medicaid is for low income.
Okay.
So, and if someone is older and low income, or disabled and low income both, then they actually get both. And you can have a dual plan for that. Those dual plans actually are very generous because since Medicaid, so Medicare will pay, like I said, for 80% of your medical, and then there's also supplements and Advantage to go with it. Medicaid, it's a little bit, again, confusing because it depends what level you're at. But the full Medicaid level will basically pay for all of the medical expenses. And so if someone's on both Medicare and Medicaid, those plans are very generous because the government is paying for all the medical expenses. And so then there's this over-the-counter spending card that people hear a lot about on those dual plans, and that can help with a lot of not only over-the-counter things like Tylenol, but also is eligible for people with chronic conditions to help with healthy food and transportation, even if people need and things like that. So one thing I probably should mention too with Medicaid is that it's different once you turn 65. So if someone is my age or less, and your income is kind of like below average, but not really low, usually that person can get coverage for their children and maybe not themselves. If someone's income is lower, though, at my age, they can get it. Now, when you turn 65, though, they not only look at your income, but they're also looking at your assets because, again, a lot of seniors, right, they may not be making as much monthly, but they've saved up perhaps. And so the big thing that's important for that is that, and we'll talk about this more later, I'm sure, that one of the big things that Medicare does not cover is long-term care. And so now Medicaid does. And so what has to happen, though, for someone to have Medicaid pay for the nursing homes that are so expensive is they need to not only have low income, but then they have to drain their
kind of the spend down.
Yes, correct. So that's why is that, again, there's not just an income requirement, but you can only have, I think in Michigan it's $10,000 about.
That sounds about right.
So you kind of have to spend all the way down to that before Medicaid kicks in for the long-term care things. Yeah.
Good to know. What should caregivers know when helping a parent or a loved one enroll?
Sure. I think some of the most important things, other than, of course, what your personal health is and needs, would be everyone, for the most part, has doctors that they like and trust, and so you want to be sure that those are covered in a network. The next one I mentioned before, drugs. For the most part, generic drugs are going to be covered by almost all the programs, but if you're on a if you're on a name brand drug, then some plans will cover that and some won't. So I want to be sure that your doctors are in network, and then also that your name brand drugs are covered. And so for instance, the diabetes and weight loss drugs are really popular right now. So if someone is on Ozempic, I want to say like Priority covers that, or if it's Mounjaro, I think like HAP or Blue Cross cover that. And so you kind of just want to be sure, what the drugs are, because different companies will cover different ones for that. So, and finally, I think, in addition to your health needs is where your budget is at. Again, there's a trade-off. For the most part, the higher the coverage, the higher the expenses usually too. And so you're trying to think through what's the priority for that. And finally, I think what you want to know for enrolling in Medicare or anytime you're buying something important, I guess, is this somebody or a company that you can trust?
Yeah.
So you want to get that ahead of time. Is this someone I can feel comfortable with and trust? Yeah.
If listeners only remember one thing about Medicare, what should it be?
That'd be. I heard a phrase once and this is in life in general, but I think it is very true with Medicare too, is that they say it's better to prepare than to repair.
Yeah.
And so maybe that would be a good little easy to remember phrase that it's much easier to, there is more work, right, to have to research ahead of time about what to do, but it's a whole lot more research if you make a mistake and you need to undo things.
Absolutely.
So I do think it's worth it to do the work ahead of time, because it's much less stressful and much less consequential if you can do the preparing. So, and I mentioned, I think, again, finding someone you can trust, this is something that is worth getting advice on. Again, no one needs to feel ashamed that they don't understand it, or you don't need to try to prove yourself by doing it all on your own. There's every reason in the world to get advice. And actually, so for health insurance agents, what's really nice about using us is that it actually doesn't cost anything. So we get paid a commission by Blue Cross or by Humana or whoever people sign up with. So you can sign up on your own, but it doesn't save you any money, actually, because, again, there's no fee to use an insurance agent.
Oh, that's great to know.
Yep. So, I mean, you still need to find one you can trust. But the good thing to know is that, I think people are concerned, like, if I use an agent, then I have to pay these extra fees.
Actually, I think people wouldn't worry about that. Yeah, so that's great information.
A misconception that it shouldn't be a hesitation for anyone to use an agent.
Well, thanks, Kevin. I appreciate that.
Yeah.
And Kevin, thank you for helping us better understand the foundations of Medicare and why planning ahead is so important. If you're helping a loved one navigate healthcare decisions, we hope today's conversation has given you a clear understanding of where to start and what questions to ask. Thank you for joining us under the tree. If you found this episode helpful, please subscribe and share it with another caregiver who may benefit from the information. See you next time under the tree.